Health Canada estimates every year 11 to 13 million Canadians suffer from foodborne illness. An E. coli death last month in connection with an Okanagan cheesemaker has drawn attention to food safety. Hansen has details on a few ways you can protect yourself from getting sick.
And now, To Your Health, brought to you by Evergreen Pharmacy and Heart Drugs.
More cases of E. coli are still being confirmed from tainted cheese at a Salmon Arm area farm, several in the Northern Health area. Canada's health agency is now reporting 23 have been diagnosed as suffering from an illness after eating the cheese, including an elderly woman who died. How can you protect yourself from foodborne illness? A good way is to be mindful of what's going into your grocery cart.
If you're purchasing meats, you should be making sure that they're packaged properly and that there's a Canadian logo stamped onto it. That means it's inspected and comes from an approved source. If you're purchasing vegetables or fruits or any other produce, you should be checking to make sure it's whole in condition and that it's not moldy and it's not been damaged in any way. If you're purchasing anything packaged, make sure that the package is intact. If you're purchasing anything canned, make sure it's not dented or bloated.
Keeping receipts is also a good way to monitor whether you've purchased a food that may end up being recalled. And there is a select group of people who need to be very careful when consuming undercooked meat and eggs, along with raw milk products.
I would recommend for people who are immunocompromised, so either you're really young or you're really old or you're pregnant or you are taking any medication like antibiotics or you're undergoing chemotherapy, which makes you more prone to illness, that you shouldn't be consuming things of high risk.
As the norovirus season begins, it may be difficult to tell whether the illness is of a foodborne nature or it is what many refer to as the flu. Many food poisoning cases go undetected because the person who is ill doesn't go to the doctor. It's estimated for every one case, anywhere from 10 to 100 go unreported. And that's why it's important to get medical help if symptoms continue or become extreme.
The most common symptoms of foodborne illness are vomiting, diarrhea, stomachache, as well as nausea.
Although you can't always tell when you get a foodborne illness, the best protection is prevention by washing your hands after going to the washroom, before preparing food and before eating, as well as making sure your food is cooked thoroughly. To Your Health, Hansen, CKPG News.